Uh, Good evening, everybody. I am Dr. Naina Shah. Welcome to our YouTube channel, which now has been operational since last 6 months, and we have been broadcasting programs and material for mental health, mental hygiene, emotional well-being of children and adults around us. Now, we have started a series of mental health hygiene since the last 1 month, and we have started some topics which we have taken which are important to be considered, not as mental health demotivators, as problems in mental health, or as issues to be tackled for mental health consideration amongst children or adults. Today's topic is anxiety disorder in children or adults. Now, because anxiety is a very, very common thing that we all go through in our day to day life, it's a normal phenomenon. If people are anxious, it's not abnormal. But some kind of anxiety then falls into the abnormal range, and we have to understand what range, what that range is. Okay, so it's anxiety is a general adaptive response to a stressful event. Whenever there is stress, people become anxious. So it unpleasant experiences of life of anxiety enforces or motivates one to reduce the danger. Okay, so if I become little anxious, then a stressful event helps me to cope with that situation. Anxiety stimulates the person, okay, to mobilize active coping mechanism for reducing the danger. So if I see some danger around me, okay, and if I become anxious, then that coping mechanism helps me to become little more mentally and psychologically balanced in life. Anxiety is the feeling of apprehension, worry, uneasiness, or dread that something adverse will happen. Okay, it is often accompanied by physiological responses like palpitation, shortness of breath, okay, perspiration, tremors, and motor restlessness. Okay, anxiety is also deemed abnormal when excessive, irrational, prolonged, and causes impairment and educational functioning, or when it causes subjective distress. So when you're very distressed, excessively distressed, that you cannot cope with the situation, and there is excessive anxiety, it is important that you show a counselor or a therapist who is around you. All people have fears, and to have fears is a normal thing. But and children are especially vulnerable to fears and anxiety because of limited knowledge and understanding. Okay, expression of anxiety in children is often in the form of fear, shyness, timidity, withdrawal, and internalization syndrome. Sometimes they do not express themselves, but internally they show some symptoms of withdrawal, and you have to really guess that this child or this adult is really showing symptoms of anxiety. Anger may be a component of anxiety, explaining co-occurrence of anxiety with externalizing disorders like disruptive behavior, hyperactivity, or truancy. Now, there are some kinds of anxiety that we need to understand. What are the different kinds of anxiety that people really go through? One of the important types is stranger anxiety. And stranger anxiety definitely starts from the little child when he enters the mother's womb. Okay, this anxiety is known to the child because it is the first contact with the mother that the child has in his ages of in the womb, and at that time he feels very anxious that how he will really cope with the new person who is around him. So one kind of anxiety is stranger anxiety. The second kind of anxiety is a separation anxiety. This anxiety is when you have to separate from somebody, you have to be apart from somebody, you have to leave somebody and go away someday. Uh, so there's a, for example, you have to go for a school picnic or on a tour or for a medical checkup, and you're not going to meet your close ones very soon. Okay, then that kind of anxiety is called separation anxiety, that you are going to separate from your dear one, and that separation causes anxiety in your mind and heart. Another anxiety is a general anxiety, which is worry about number of associated events associated and with symptoms of hyper arousal. So sometimes there is so much of arousal in your body, mentally and physically, that those symptoms also cause anxiety in your mind and body. School phobia. Many times people have fear of authority, fear of teachers, fear of going to the school. So many times they also show symptoms of aphobia, where whenever they have to go to school, they show symptoms of high level of stress or anxiety. Examination phobia. When you have to give an exam, many people like become, they start perspirate, perspiring, they start vomiting, they start all kinds of physical symptoms are seen when examination is around the corner. So examination phobia is also one of the kinds of anxieties that people really go through, and we need to be really cautious if we see anybody around us with a symptom of examination phobia. Now, other presentation of anxiety disorders are stammering, nail biting, habit disorders, nervousness symptoms, post traumatic stress disorders, adjustment disorders, also presenting with obsessive compulsive behavior. What is obsessive compulsive behavior? You are obsessed with carrying out a particular behavior, like you go on washing your hands 20 times a day, or you go on tying your shoelace 5 times, or so those kinds of obsessive compulsive disorders also are a sign of anxiety and stressful events. Okay. Uh, these are the different kinds of anxiety and disorders that occur in children or even adults. I think what we need to do is the- up to the normal level, we can handle it at home. The parents can handle, teachers can handle, counselors can handle. But when it goes beyond, it becomes excessive or abnormal level, then I think it is important to go and see a counselor, to go through therapy, go through some kind of a psychiatric treatment, which is also required in these kinds of cases. Thank you so much.